Okay, so today we're talking about the humerus. This is the humerus. Whoa, there we go. All right, it's going to form this portion of your arm. It's the upper part of your arm. And again, whenever you picked up a paired bone in the human body, you want to figure out left or right. So the two features that are probably the easiest to use are this one right here. It's called the head of the humerus, and that's what articulates with the glenoid cavity and the scapula, right? So if you guys remember, on the scapula, that glenoid cavity faces lateral. Okay? That means that this head of the humerus, to articulate with that, needs to face medial. And so this area right here is going to be proximal and medial. Right? Proximal means closer to the point of attachment. So proximal and medial. The other structure we use is on the posterior side. Right? Can you see that? That's called the olecranon fossa. Right? Olecranon, the root of that means elbow, and cranon, like cranium, means head. So if you guys remember that fossa is a depression, what you're going to see here is the head of the elbow is the depression for the head of the elbow basically, and that's where it's going to sit into. All right, so we set that up posterior. So head of the humerus is medial, olecranon fossa is posterior, and right there we have the right humerus. All right, and again, there's 12 structures on here, so we're going to work our way through, and it's not too bad because there's some overlap and everything. Okay, so head of the humerus. Right below that, there's a depression, right? And so it rings right at the base of the head, and that's called the anatomical neck. Down here, there's a surgical neck, right? So surgical neck, anatomical neck. The anatomical neck also separates the greater and lesser tubercles. All right, a tubercle is just a bump, and greater is always referencing larger. So if you see something called greater, it's going to be bigger. If you see something called lesser, it tends to be smaller. Okay, so we have a greater tubercle, a lesser tubercle, and the intertubercular groove. Right, so how Stella got her intertubercular groove back was a movie, the sequel to the 1998 film. No, it wasn't. But greater tubercle, lesser tubercle, intertubercular groove. All right. Right here, about halfway down the shaft, you can't really see it too well, but right in this general region, it's called the deltoid tuberosity. All right, and so the deltoid tuberosity, any tuberosity is a rough patch. And so rough patches in general, when you see those, are points of attachment for muscle, right? And so I'll give you three guesses what the deltoid tuberosity or which muscle attaches to the deltoid tuberosity. And if you guessed deltoid, then you are a genius. All right, so that's it for the top half of the humerus. All right, so as we work our way down a little bit lower, it gets a little trickier, but there's some mnemonic devices that might help, and you can kind of come up with your own if you think it might be easier. Posterior side, we already talked about the olecranon fossa, right? So if we look anterior, we have a bunch of condyles and epicondyles, right? So right here is going to be, right, since it's a right, we're looking at the medial side. This is the anterior portion. And so anterior side. This is going to be the medial condyle. And the medial condyle has a special name. It's called the trochlea. All right, so trochlea, medial condyle. Lateral condyle is going to also have a special name. It's called capitulum. All right, so capitulum, trochlea. So for the capitulum, I like to remember it that the lateral condyle, LC, like from that chick from the hills, right? LC, lateral condyle. Mr. T, MT, medial condyle is a trochlea. MT, trochlea. Above that, you're going to have a medial epicondyle and a lateral epicondyle. Epicondyle, epi means on. Condyle basically is an area of articulation, so a joint. So you have your medial epicondyle is going to sit on top of your condyle, right? So you have trochlea, medial epicondyle, capitulum, lateral epicondyle. And we won't really worry about these fossas yet. We'll get into them a little bit more detail in following semesters. The only fossa that you need to be aware of right now is this guy right here, the olecranon fossa. So again, real quick, I'm just going to walk through it. We're looking at a right humerus. I have it set up in anatomical position, right? Standard anatomical position right here. head, anatomical neck, greater tubercle, lesser tubercle, surgical neck, deltoid tuberosity, lateral epicondyle, capitulum, trochlea, media epicondyle, olecranon fossa.